Hi, I'm Garvin. Welcome to our telehealth video series. In this video, I will give a brief overview of what you need to know about croup. In particular, I will cover what is croup, how you treat croup, and how you manage symptoms more effectively. So we start with what is it? Croup is a childhood condition that affects the windpipe or trachea, the airways to the lungs, and the voice box. Children with croup have a distinctive barking cough and will make a harsh sound known as a stridor when they breathe in. They may also have a hoarse voice and find it difficult to breathe because their airway is blocked. Croup can usually be diagnosed by a GP and treated at home. However, if your child's symptoms are severe and they're finding it difficult to breathe, take them to the nearest hospital and emergency for accident emergency treatment. So who is affected by croup? Croup usually affects young children aged between 6 months and 3 years age, with most cases occurring in 1-year-olds. However, croup can sometimes develop in babies as young as 3 months and older children up to 15 years of age. Adults can also get croup, but this is rare. The condition is more common during the late autumn and early winter months. It tends to affect more boys than girls. A child may experience croup more than once during their childhood. So the symptoms of croup. A child can get croup at any time of the year, although it's more likely to occur during late autumn and early winter. This may be because there are more viruses, such as colds and flu, around this time of year. Typical symptoms of croup is a bark-like cough, a hoarse or croaky voice, the difficult breathing, and a harsh grating sound when breathing in. In severe cases, croup can also occur when the child is resting or sleeping. Symptoms tend to be worse at night. Some children have cold-like symptoms for a few days before developing croup symptoms. These cold-like symptoms include sore throat, runny nose, cough, high temperature, or a fever. Now, although croup symptoms usually only last for a few days, they can occasionally last up to 2 weeks. So croup is typically diagnosed by a GP, and they will observe your child's breathing, listen to your child's chest with a stethoscope, and examine your child's throat. Sometimes x-rays or other tests are used to rule out other possible illnesses. So the risk factors. The most at risk of getting croup are children between 6 months and 3 years. Because children have small airways, they are most susceptible to have more symptoms with croup. So how do you treat croup? The majority of children with croup can be treated at home. Still, croup can be scary, especially if it lands your child in the doctor's office, emergency room, or hospital. Treatment is typically based on the severity of symptoms. So just some comfort measures you can use. Comforting your child and keeping them calm are important, because crying and agitation makes airway obstruction, could worsen it. So hold your child and read to them. Offer a favourite blanket and speak in a soothing voice. There are medications you can take, so if your child's symptoms persist beyond 3 to 5 days or worsen, the GP may prescribe medicines such as a steroid medicine can be given to reduce inflammation in the airway. The benefits typically will be felt within a few hours. A single dose of a steroid is usually recommended because of its long-lasting effects. There's also Pulmicort. It's an inhaler, also is effective in reducing airway inflammation and may be given in the inhaled form. So for severe croup, your child may need to spend time in hospital to be monitored and receive additional treatments. So how do you live with the symptoms of croup? Croup often runs its course within 3 to 5 days. In the meantime, keep your child comfortable with a few simple measures. Stay calm, comfort or distract your child, read a book or play a quiet game, provide a humidified or cool air. Although there's no evidence of benefit from this practice, many parents believe that humid air or cool air helps a child's breathing. If it's cool outside, you can open a window for your child to breathe cool air. Hold your child in a comfortable upright position. Hold your child on your lap or place your child in a favourite chair or infant seat. Sitting them upright may make it easier to breathe. And offer your child fluids. For babies, breast milk or formula is fine. For older children, soup or frozen lollipops will be very soothing. And encourage rest. Sleep can help your child fight the infection. And also try a fever reducer. If your child has a fever, over-the-counter medicines such as paracetamol will bring the fever down. Skip the cold medicines. So over-the-counter cold medicines aren't recommended for children and can be harmful in children less than 2 years old. So your child's cough may improve during the day, but don't be surprised if it returns at night. You may want to sleep next to your child or even in the same room so that you can take quick action if the child's symptoms become severe. Finally, there are numerous products available at Lynch's Pharmacy in Douglas to assist you in managing croup more effectively on a day-to-day basis. We have various supplements and products which you can purchase from us without a prescription, such as cough bottles, Calpol, Nurofen for fever, multibiotics and cough sweets. So that brings this video to an end. Customers of Lynch's Pharmacy can avail of a brand new offering, a telehealth clinic. You can book a 30-minute clinic with us and we help increase your understanding of your illness. During a clinic, together we create a cohesive management plan which enables you to take a more active role in managing your illness with confidence. We provide you with the tools you need to live a healthy life. Call into us at Lynch's Pharmacy in Cork or call 021 436 6923 to find out more. Thank you for watching. Stay healthy and stay informed.